morning. Natural Health Matters. Zeeva Diabeto Care, your natural partner in diabetes management. Now, we are very confused regarding diabetes. The diabetes crisis is increasing day by day. If we see the global impact worldwide, 537 million adults live with diabetes. And this is the data from WHO, World Health Organization, and it is very recent data, that is 2023. And if we see the death, that is near about 6.7 million annually linked to diabetes complications. When we talk about the diabetic complications, you will find that it can be chronic kidney disease or maybe heart disease. These two are mainly responsible. And also you will find that there is a neuropathy, there is a retinopathy, even also cardiovascular problem. Now, what is a causative factor for diabetes? Always this come in the picture that why all of us not suffering from diabetes, some of us are suffering from diabetes, and what is a causative factor for that? First of all, I would like to tell you that diabetes is a hereditary disease. That means my parents, they are suffering from diabetes, then I'm more prone to diabetes. But even also, if my parents are not diabetic patient and my forefather is not diabetic patient, can I suffer from diabetes? Answer is yes, we can suffer from diabetes. What is the reason? The first reason is the obesity. If I'm overweight and if I'm obese, then what will happen? That maybe the insulin will be released in my body, but it will not be utilized by the body effectively. So obesity is one of the major reasons for diabetes. Then poor diet. We are not taking the balanced diet. We are taking fast food, fried food. This is also responsible. And our sedentary lifestyle. You will find that most of the people, they don't do any exercise. Maybe they are taking restricted diet, but they don't do exercise, means there is no calorie burn. So sedentary lifestyle leads to obesity, and obesity leads to your peripheral insulin resistance, means whatever insulin will be released in our body, it will not be utilized by the body. And because of that, blood glucose level will increase. So what is the impact of that? If I suffer from diabetes, what will be the implications? Implication is the cardiovascular disease, number one. Second one, you will find that there is a damage of the nerve and multiple organ can be failed. And you will find that our immunity and energy go down. Now coming to that, in this scenario, is there any solution? Can we come to a solution that yes, if I'm suffering from diabetes or I'm more prone to diabetes, anything is available which will take care of that? Yes, that is Zeeva Diabeto Care. So a science-backed solution. The question is that why Diabeto Care Zeeva formulations I have to take into consideration? Why not other formulations? Why other formulation is not in a position to reduce the blood glucose level? A lot of people, they have tried with multiple formulations, and it has been found that the blood glucose level is not being controlled effectively. Now, coming to our formulations, our formulations is made of four things. Number one is that there is a herbal extract, which is very well known for reducing the blood glucose level. Second one is that in case of nutraceutical, you will find certain vitamins, minerals are responsible for reducing your blood glucose level. Not only blood glucose level, they will reduce the cholesterol level, they will improve the immunity, they will take care of the gut health as well. So these vitamins, minerals, we have taken into consideration in our Zeeva Diabeto Care. Even you will find that for gut health and immunity, these two aspects, if you look into, And particularly in diabetic patients, you will find that the gut health is not up to the mark. They suffer from constipation or loose motions. Second one, immunity will be very low in case of diabetic patient. See, this Ziva Diabeto care not only controlling your blood glucose level, it will also take care of your gut health and immunity. Now, what is there in the Ziva Diabeto care? What are the ingredients are there? First of all, I have told you that your herbal extract we have taken into consideration, which is approved in the Nutra. One is Gymnema. Gymnema, we all of us know that Gymnema, it's really stimulate insulin secretion from the beta cells. Not only that, it also delays the glucose absorption. And that is also we have given in a therapeutic concentration that is 100 milligram. Then coming to the jamun. Jamun is well known for reducing the blood glucose level. It basically enhances insulin sensitivity. I have told you that my insulin secretion is quite normal, but my body is not in a position to utilize the insulin because of the obesity. Yes, here the role of Jamun. Jamun will help insulin to bind with insulin receptor, though I have a obesity. Then coming to the most important ingredient we all of us know, that is beta-melon. That is your Karela, which boosts glucose uptake. So once it increases glucose uptake, blood sugar level goes down. And the fenugreek, that is methi, 150 milligram, which basically slows carb absorption. That means the glucose, generally it is being absorbed from the gastrointestinal tract, that is small intestine. It slows down the glucose absorption and it stabilizes blood glucose level. Now, coming to the most important ingredient, that is Salacia reticulator, which we have taken into consideration 100 milligram, which basically blocks the conversion of starch to glucose, that is in sugar, that is monosaccharide. So generally, whatever roti or rice we take, basically it ultimately converts into glucose, then fructose, and galactose. So if it cannot be converted into your glucose, then it will not be absorbed in our body. So the blood sugar level will not increase. Then most important antioxidant, that is alpha lipoic acid, we have taken into consideration. You will find that the major problem in diabetes, that is oxidative stress. Then alpha lipoic acid protects nerves from oxidative stress. We have come across that a diabetic patient, they are more prone to neuropathy if their blood glucose level is not being controlled. The reason very simple. If my blood sugar level is in elevated conditions, then excess glucose will be converted into sorbitol, and that sorbitol damages the nerves. Now, biotin and chromium, these two ingredients basically enhances glucose metabolism. And zinc, vitamin D, zinc, it is an antioxidant. Not only that, it also boosts of our immunity. And vitamin D has three different functions. It stimulates your beta cell to release insulin so that it will reduce our blood glucose level. Not only that, whatever insulin will be released from beta cell, it can be utilized by the body effectively. And moreover, vitamin D is also improves our immunity. Now, coming to the most important part, you will not find any formulations where maybe herbal extract you will come across, or you will find that vitamins, minerals, not all, few vitamins, minerals have been taken into consideration in the formulations, but nobody has thought about your probiotic. Now, I would like to tell you what is probiotic. Probiotic basically are beneficial bacteria, which is found in our gut. But when this beneficial bacteria, because of the pathogenic bacteria, it goes down, then we have a problem of gut health. And generally, we come across in case of diabetic patient that they have a gut health problem because their immunity is not up to the mark. Now, we have taken into consideration two probiotic, which is very effective, particularly for gut health as well as immunity. Not only that, these two probiotic also reduces your blood glucose level effectively. One is your Lactobacillus casei, that is also strain we have taken into consideration, LC11, and Bifidobacterium bifidum, that is BB06, which is clinically studied probiotic strains. And this is the strains of DuPont. DuPont has been taken over by IFF. Now, this particular probiotic is coming from IFF. We have imported this particular probiotic from IFF, and we have taken into consideration in our formulations. Now, coming to the Lactobacillus casei, that is LC11. Now, if we take into consideration this particular probiotic, it balances gut microbiota. So it reduces harmful bacteria, pathogenic bacteria. Then also it enhances short chain fatty acid. Short chain fatty acid production basically improve the insulin sensitivity. So whatever insulin will be released from beta cell, it can be utilized by the body effectively. Not only that, Lactobacillus casei modulates our immune. Even also, it is diabetic specific benefit what I was talking about, that it lowers fasting blood glucose level effectively. Not only that, it reduces inflammatory marker. In case of your diabetic patient, you will find that CRP level, ESL level always will be in elevated condition. So it reduces your CRP, C-reactive protein, as well as ESL. Even Bifidobacterium bifidum, that is BB06, this particular probiotic suppresses your inflammation. Not only that, improves your lipid metabolism, so it reduces your bad cholesterol, that is your LDL, VLDL, because this bad cholesterol generally it deposits inside the coronary artery and it leads to atherosclerosis. That's why this coronary artery is not in a position to supply the blood to heart, and our cardiovascular complication arises. And this particular probiotic, as because it reduces your cholesterol and triglycerides, so there will be no deposition of bad fats inside the coronary artery. So your heart will get proper blood supply, and there will be no ischemia, no angina pectoris, or chances of myocardial infarction. And it also modulates glucose absorption, and it is very diabetic specific because it reduces HbA1c level. That is glycosylated hemoglobin. I just would like to give you a little bit brief regarding HbA1c. That is HbA1c, that when you have a excess glucose in the bloodstream, this excess glucose bind with the hemoglobin. And that percentage basically indicates that your blood sugar level, it is in elevated conditions or not. Generally, 6% is well accepted. If it is more than 6%, then you will find that your blood glucose level is always in elevated conditions, and this excess glucose is binding with your hemoglobin, and that percentage is increasing. So this combined synergistic action, Zeeva Diabeto Care, is a total 5 billion CFU of your clinically documented probiotic. Even it has a gut-brain immune axis. Not only that, evidence-based probiotic, which is backed by the clinical trial, and it is importing from DuPont, which has been taken over by IFF. And it basically taking care of these biases when you will find that imbalance of your pathogenic bacteria and beneficial bacteria. When pathogenic bacteria scores over your beneficial bacteria, then there is a dysbiosis occurs, and there will be a lot of complications. You will find that worsening of insulin resistance, and you will find the blood sugar level goes up. Not only that, short chain fatty acid, which is being produced by these two probiotics, so that will helps in taking care of blood sugar level. Not only that, it controls inflammation. That means C-reactive protein, ESR, this inflammatory marker will be controlled effectively. That's why the probiotic should be added to the any anti-diabetic formulation or fixed dose combinations of anti-diabetic. And why probiotic is in Zeeva, now it is clear to all of you. So at a glance, if we see that this balances blood sugar spike, that means it controls fasting blood glucose level, postprandial blood glucose level as well as HbA1c level, enhances insulin efficiency. That means whatever insulin will be released, it will be utilized by the body and curbs unhealthy craving. Not only that, it will take care of the multi-organ failures, not only protects your nerve, it also protects your kidney as well as heart. Even it strengthens your gut health and immune. So 100% natural, no synthetic additive have been added to your Zeeva Diabeto Care, and moreover, clinically proven. Even it has been found that when Zeeva Diabeto Care, it has been taken for 8 weeks, there is a lowering of your HbA1c level. Not only that, it improves the energy level. You will find in case of diabetic patient, always they suffer from tiredness and fatigueness. So tiredness and fatigueness will be taken care of. They have a very poor immunity, the improvement of immunity, and simultaneously their gut health is very delicate. And because of this probiotic, adding to your Zeeva Diabeto Care reduce the risk of complications of the gut health. So, in a nutshell, if we look into the USP of this product, unique selling proposition, and if we would like to differentiate from other conventional formulations which are available in the market, so-called, they say that it take care of your diabetes. You will find that in case of Zeeva Diabeto Care, multi-target approach is there. There is a herbs, there is a nutrients, that is vitamins, minerals, and probiotic. And the probiotics, whatever have been used in case of Zeeva Diabeto Care, which is clinically validated and backed by research. So it has to be taken one tablet twice daily after meal. It can be taken after breakfast or after lunch, and after dinner, one tablet to be taken. And it is very safe, natural, zero harsh chemical is there. So, how many days it has to be taken to get the effective result? Yes, to get the effective result, it has to be continued for 8 weeks. But the first 10 days, the person will be able to get the result. They will see that the tiredness, fatigueness, gut health, even immunity, it has been improved. And taking a glycemic control today, yes, of course, you have to Zeeva Diabeto Care to be considered, and Zeeva Diabeto Care not only taking care of reducing the blood glucose levels simultaneously, it is taking care of the diabetic complications, that is natural nephropathy, retinopathy, and also you will find that health complications, not only that, you will find that they also suffers from retinopathy, that means complete vision loss. So, Zeeva Diabeto Care, where the nature meets science. Thank you very much for patient hearings.